But we are in conflict because of the elements of this bill. And I'll make two basic points in my remarks tonight, one about Medicaid and then one point about another provision in the bill which I think is particularly insulting. A lot of our discussions start with policy and data, and that's important. And that's obviously part of the debate about the bill and what's in it and what impact it'll have on programs and people over a long period of time. But part of this debate, of course, is about people that we represent. I know the presiding officer understands this, and I'm heartened that he's paying attention to our arguments here, because sometimes I've done it myself. When you preside, sometimes you're doing something else. So we're grateful for his attention. But I've talked on this floor a couple of times over the last couple of weeks, even months, and I won't repeat the stories because they've been told a number of times, but Rowan Simpson is a young man that I just recently met. His mom had sent me a letter. Rowan is on the autism spectrum, and his mom is very worried about his future because of the potential impact on Medicaid and the benefits he's getting today from Medicaid. Just referred the other day, I guess it was Thursday on the floor, to a letter from a dad about his son, Anthony, who has a number of challenges, one of them being one of several, I guess maybe one of four, that he's on the autism spectrum. Just have another letter as well, which I won't go through tonight, but it's from a mom in northeastern Pennsylvania writing to me about two of her children, principally her son who has type 1 diabetes, and what the loss of Medicaid coverage will mean for that child, in this case, just 4 years old. So everyone in this chamber in both parties has stories like this to tell. Stories about people who are totally dependent because of a disability, totally dependent upon Medicaid. That is not unique to one state, and of course it's not unique to one party. But one of the more egregious and objectionable parts of this 140-plus page bill is the impact it will have on Medicaid, both the Medicaid expansion, which many people know now represents probably on the order of 11 million people that got health care coverage since 2010, got that coverage because Medicaid was expanded. But the bill also speaks to the Medicaid program itself by the so-called per capita cap, capping the dollars that the federal government would provide in the future with regard to the federal-state partnership on Medicaid. So these are big stakes when it comes to a program that has been with us for 50 years, and as everyone knows, Medicaid is principally about individuals with disabilities, and that's obviously those children I mentioned. It's about folks who need some help getting into a nursing home, senior citizens, and of course it's about kids from low-income families who have no other health care absent Medicaid. In our state, it just happens to be 1.1 million kids on Medicaid from low-income families, and the disability number, both children and adults, is, by one estimate, more than 722,000 people. So these are big stakes, even if it's just involving one of those individuals, or hundreds or thousands. But as I'll refer to later, some of the numbers are, of course, a lot higher than that. So those stories and those pleas for help from those families obviously not just inform us, but inspire us to keep working, to keep fighting. And I'll be fighting against this bill and as long as it takes. But it's likely we'll have a vote this week. I'm assuming we will. So we only have hours and a few days to fight and to point out what we believe to be the defects. One of the things that's significant about this debate is that we've had people not just writing those stories, but telling us their story, but also telling us and giving us ideas about how to conduct the debate and how to fight and how to oppose it. I've got in my hand, and I'll describe it first before offering a consent request, but I have in my hand several pages that list almost 600 names from people in Pennsylvania that have written to me over the last number number of weeks and months, actually. And what they're urging me to do is to pursue a legislative strategy to protect their health care. Now, why are they doing that? It's not because they have nothing else to do. They're worried. These people are really worried. They're worried about those kids like Rowan and Anthony that I just mentioned, and a 4-year-old with type 1 diabetes, or a whole long list of other disabilities that a lot of kids have. They're worried about their parents, who may not be able to get the long-term care they need if Medicaid is capped and cut and decimated. They're worried about their friends and their families. They are, in a word, worried as anyone has ever been about the health care of those they love and the health care of those that they care about. That's why they're writing and going to meetings and making phone calls and engaging in such a robust way all these weeks and months. So, Mr. President, with regard to this particular list, I would ask consent that this list of almost 600 names from Pennsylvanians be made part of the record.
Without objection.
Thank you, Mr. President. I'll make two final points about Medicaid and then juxtapose Medicaid with another part of the bill. If you look at the bill, it's about the 140, I guess 42 pages. More than 60 pages deal with Medicaid. So this is principally a bill about Medicaid. There are some other issues obviously addressed on the exchanges and the fundamentals of health care, but it's mostly about Medicaid and tax cuts, unfortunately, and that's particularly objectionable to me, that you've got a small group of very wealthy people that are going to make out in ways we can't even imagine, like a big bonanza for the super rich. But let me just talk about the Medicaid part of it first, and then I'll refer to a chart. I'm holding in my hand the Congressional Budget Office report from today, which came out, which of course is a document produced by the Congressional Budget Office as well as the Joint Committee on Taxation. So it's a joint effort. And on the CBO, so-called CBO, Congressional Budget Office report from recently, a couple weeks ago now, on page 17 of that document, there was an assessment made of the number of people who would lose Medicaid as a result of the House bill. And that number was 14 million Americans would lose Medicaid over the decade up until 2026. Well, unfortunately, as of 4-something this afternoon, I guess about 4 o'clock, 4:30, we got the Congressional Budget Office assessment of the Senate bill. So the Senate bill that was unveiled last week, and not on page 17 in this report, but actually on page 16. Here's what the Congressional Budget Office and the Joint Committee on Taxation says about enrollment in Medicaid, and I'm quoting at the bottom of page 16. Enrollment in Medicaid would be lower throughout the coming decade, with 15 million fewer Medicaid enrollees by 2026 than projected under current law in CBO's March 2016 baseline. And they refer to a figure in the report. So House Bill CBO assessment says 14 million will lose Medicaid coverage. Senate bill, analyzed by CBO, which is supposed to be a more moderate bill, a better bill in the eyes of some Republican members of the House and the Senate. That was supposed to be better, but here's what we know now. 15 million people will lose Medicaid. That alone should cause any senator to be very concerned about the impact of this legislation. That alone should, I hope, require some people to use an old expression, examine your conscience about what will happen if you vote for this legislation. But let's say that someone says, you know what, I can put that into context, and I think that actually that won't happen, or I have another explanation, or whatever justification or rationale you use for voting for a bill that will result in 15 million people losing Medicaid coverage. People are very vulnerable. Let's just say you can analyze that a different way and come to a different conclusion. We'll see how people deal with that number this week, and when they go home and when they have to talk about this legislation over time. But here's where it gets a lot worse. Now this is a chart that's rather simple, even though it's got a lot of data on it. It's rather simple. Here's what it says at the top. First of all, this isn't my chart. It's Center on Budget and Policy Priorities, and you can go to cbpp.org to see it. Now this is based upon the House bill, but I just told you that the Medicaid enrollment number is 1 million higher, or the number losing Medicaid is 1 million higher under the Senate bill. And the tax cuts that are in the Senate bill are almost identical. You can just go down and count them to the House and Senate bill are virtually identical on tax cuts. But here's what the headline is. Tax cuts for top 400 roughly equal to federal spending cuts from ending Medicaid expansion. Now remember, I said before that Medicaid expansion is one problem that I see. The per capita cap is another. So this chart just deals with one of the Medicaid problems, Medicaid expansion. So ending Medicaid expansion in Nevada, West Virginia, Arkansas, and Alaska. Just 4 states, right? So Alaska, they project, will lose $2 billion worth in Medicaid over the decade. Arkansas would lose 7. West Virginia would lose 12, and Nevada would lose 12. So that adds up to $33 billion federal Medicaid cuts from ending Medicaid expansion. $33 billion, just 4 states. By the way, not really high population states. There's no California, New York, or Texas, or big states like that, right? So $3 billion lost in Medicaid, or $33 billion lost in Medicaid in just those 4 states. What does this orange bar graph show? The same number, $33 billion, tax cut for the 400 highest income households in the country. The same number. So 400 households get a tax cut of $33 billion, not in some other bill down the road, not in some other year, not in a budget bill or a tax bill. They get this massive tax cut in what's called a health care bill. And at the same time, it's equivalent to the total Medicaid loss in just 4 states. It gets worse if you add more states. Guess what? You can add if you add up about 30 states in a different chart, it's about the same as all the tax cuts together. But here we're just talking about 4 states and 400 families. I hope I'm not offending anyone if they're in those top 400 households who are making either billions, or by one estimate, the average might be 300 million. I know it's been difficult to make ends meet. You've been struggling and trying to pay the mortgage and the light bill when you're one of the top 400 richest households in the country. But this chart, when you juxtapose this chart, and especially the orange part, the tax cut for 400 families, the giveaway to families that don't need it, and frankly, they don't even want this tax cut. I haven't found one person who came up to me in the last couple of years and said, you know what, I wish my taxes didn't go up. I wish those taxes didn't go up while you were trying to help people on Medicaid. Not a single person said that. Most people that will get this tax cut would rather that we make sure that we take care of those children I mentioned with a disability, or those families who need the protection of Medicaid. When you put this chart next to the policy and those 60-plus pages of the decimation of Medicaid, there are a lot of words we could use that we're not allowed to use on this floor. But one of the words we should use is obscene. That's an obscenity. When you match these cuts for 400 families next to the cuts to Medicaid, that is obscene and obnoxious and bad policy. If there was ever a reason to take this 142-page bill and throw it in the trash, throw it in a garbage pail as fast as we can, it would be this chart. Because that's not what the American people are asking for. They actually think that some people in the Senate are actually working on a health care bill. That's what they believe. A lot of people don't know about this yet, but they're going to know. They're going to know by the end of the week, at least, if not sooner, that the 400 richest households in the country are getting that much money, $33 billion. Maybe in the Senate bill it's only $32 billion or $31 billion. So we'll stand corrected if it goes down. But that is really an abomination. That's an insult to the American people. People should be ashamed that this is part of that bill. I get it. We can have a debate about Medicaid. I get that. But when you're taking Medicaid dollars and transferring to wealthy people, no one should support that kind of a policy. But that's what we have. That's what we're up against. And if there was ever a reason to fight to the end of the earth against a piece of legislation, it is this. We're going to continue to fight this. We're going to continue to point out this basic inequity, this insult, for the rest of this week. We hope that folks on both sides of the aisle will not only be listening, but we hope that our Republican friends will take another look at this bill and understand how objectionable this is to so many American families. All of that worry that I talked about before is made worse, is aggravated by this kind of result when it comes to tax cuts. So we can do all that as a great nation. We can make sure that wealthy folks who need a break once in a while, they've gotten a lot of them in the last 25 years, that they can get a fair tax code. We can also make sure that kids with disabilities, seniors, and kids in rural areas and big cities and small towns can get the health care they need from Medicaid. We're a great country. We can do that. We can have a growing economy and still support a critically important program like Medicaid. And Mr. President, with that, I would yield the floor.